Hey everyone! In this video, I'll compare a CT scout image and a digitally reconstructed radiograph or DRR. Both are two-dimensional projection images and can look similar at first glance. However, they are created in very different ways, used for different clinical purposes, and have different geometric properties. Let's dive in. Let's start with the CT scout image. A CT scout, also called a topogram, is a real X-ray projection acquired before the CT scan begins. It is obtained using a fan beam geometry as the table moves through the scanner. Because of this acquisition method, the image naturally includes magnification, geometric distortion, scatter, and image noise. Clinically, the CT scout is used to define the scan range and plan the axial CT acquisition. It is not used directly for treatment setup or dose calculation. In contrast, a DRR is not a real X-ray image. A DRR is a computed image generated from the three-dimensional CT dataset after scan is complete. It is created by ray tracing through CT voxels using density-weighted summation to simulate what a radiograph would look like from a specific viewing angle. The geometry is typically matched to treatment or imaging geometry. Different rendering filters can be applied to emphasize specific features, allowing the DRR to resemble either a kilovoltage or megavoltage image. DRRs are primarily used for treatment setup and image guidance, serving as reference images for comparison with portal images or KV imaging during patient positioning. How can we tell them apart? There are several practical ways to tell a CT scout and a DRR apart. First, image appearance. A CT scout often appears noisier and looks more like a conventional plain X-ray. A DRR typically looks cleaner and more synthetic, since it is computed from CT data. Second, geometry. Because a CT scout is acquired with a fan beam, anatomy can appear unevenly magnified depending on its distance from the detector. A DRR is geometrically corrected, so anatomical proportions appear more consistent across the image. Third, angle and clinical context. CT scouts are limited to fixed views such as AP, PA, or lateral. DRRs can be generated at virtually any gantry angle to match treatment beam geometry. So in summary, a CT scout is a direct radiographic acquisition used for CT scan planning, and it includes real-world effects such as magnification, noise, and scatter. A DRR is a computed projection derived from CT data. It is geometrically accurate and used for treatment setup and verification. A simple rule of thumb is, if it looks like a slightly noisy X-ray used to define scan range, it is a CT scout. If it looks geometrically precise and synthetic, often matching beam geometry, it's a DRR. Thank you for watching. Bye.